So we've made advances in our genetic understanding, which is going to allow us to basically understand the pathways that could be involved. We're learning about epigenetics. So we know that almost all illnesses are a combination of genes and environment. And we've wondered, how does stress get under the skin? And epigenetics probably is one of the ways that explains it. We've learned about what we call plasticity pathways that regulates neuronal and synaptic function. That has led to the development of a novel antidepressant that works in hours rather than weeks. We've started to deconvolute our diagnostic classification, so the DSM classification, to recognize that there's actually subgroups of subdomains of illness. And what we've been able to do is map certain domains onto certain circuits and then target those circuits. So to give you one example, there's a domain related called anhedonia, which is the inability to experience pleasure. You lose drive and motivation. And we know a lot about the circuitry. So now we can target the circuitry and improve anhedonia. And in principle, you would improve anhedonia whether it's when a person is depressed, bipolar, has schizophrenia, or drug abuse. We've learned a lot about the mind-body connection and a lot of reasons to believe that the physical health comorbidities are partly due to an overactivation of parts of the immune system. And in many patients, it looks like the immune system overactivation is even driving the mental health condition. So now we're targeting neuroimmune pathways. And then we may come back to this, but I think the digital technology revolution, which is changing a lot of aspects of healthcare, I think is particularly going to help mental health. So I think there's a lot of reasons to be excited about the science. I use the term the culture of science. What I mean by that is I think the light bulb has gone on, that we can't do this alone. We're going to have progress if we work together.